Okay, what if I told you that hidden away in the dirt of one of the most remote islands on the entire planet was a secret that could completely flip everything we know about getting old? Today, we're diving into a discovery that might, and I mean literally, rewrite our future.
Yeah, seriously, think about it. For all of human history, we've just accepted that aging is this unstoppable force, right? It's just a slow, unavoidable decay. But what if that basic assumption, the one we've built our entire lives around, is just wrong? What if getting older isn't the one-way street we always thought it was?
And that's a massive shift in how we see things. You know the old view? That was easy. Aging was just wear and tear. Your body's a machine, and eventually the parts just break down. Simple. But this new idea? Whoa. It suggests aging is actually a regulated biological process, almost like a program running in our cells. And if it's a program, well, programs can be hacked, right?
Exactly. And the story of how we even got to this point, it doesn't start in some high-tech lab. Nope. It begins somewhere totally unexpected. It's this incredible tale of adventure, a super remote island, and a discovery that came this close to being lost forever.
So, picture this. It's the 1960s. A team of scientists travels to Rapa Nui. You probably know it as Easter Island. And let's be clear, they were not on some quest for the fountain of youth. They were basically microbe hunters, digging around in the island's unique soil, just hoping to find some interesting new bacteria that might lead to new medicines.
And well, in that dirt, they found something. A tiny bacterium that was pumping out this powerful, totally new compound. So, in a nod to the island, Rapa Nui, they called it Rapamycin. And at first, it was just, a decent antifungal. Cool, but not exactly world-changing. Or so they thought.
And this is where the story takes a turn and becomes the stuff of legend. Seriously, in the early 80s, the company researching rapamycin just shuts the whole program down. The compound was literally about to be thrown out. But one scientist, and you have to love this, Dr. Sirin Segal, he just refused to let it go. He personally saved the samples from the trash, basically, keeping the whole thing alive just moments before it vanished from history.
And thank goodness he did, right? Because after it was rediscovered, scientists started realizing what they had. They found it was a super powerful immunosuppressant. It kind of tells the immune system to just chill out. And that's huge, which is why in 1999, the FDA approved it to help stop organ rejection in transplant patients, a massive win for medicine. But its biggest, most shocking secret was still waiting to be found.
Oh yeah, because about a decade after that, a group of scientists stumbled onto rapamycin's most profound effect, and it was completely by accident. This is the part of the story where a pretty standard lab experiment suddenly becomes one of the single biggest breakthroughs in the entire science of aging.
Okay, so the plan was super simple. Let's just feed rapamycin to some mice and see what happens. Easy, right? Wrong. They hit this massive problem. The drug was really unstable, it kept breaking down. They just could not get it to mix into the mouse food properly. So they had to develop this special coated version to protect it, and that took a long time.
How long? Well, by the time they finally cracked the formula, the mice they were planning to use for the experiment were already 600 days old. Now, in mouse years, that's not middle-aged. That's practically ancient. We're talking the rough equivalent of a 60-year-old person. So the researchers had this huge choice to make. All the conventional wisdom said, it's too late. The aging process is way too far along. So they could either scrap the entire super expensive experiment and start all over with young mice, or they could just go for it and see what happens. They decided to push forward.
And the results were absolutely stunning. I mean, it worked. Even starting this late in the game, rapamycin still significantly extended the lifespan of these mice. And this wasn't some tiny blip on a chart. This was the first time any drug ever had been shown to extend the maximum lifespan in a mammal. It was completely revolutionary. Get ready for these numbers because they are just staggering. They saw a 9% increase in lifespan for the males and an absolutely jaw-dropping 14% increase for the females. Let that sink in. A pill started in what's basically old age, made them live that much longer. It was unbelievable. Okay, so obviously this brings up the billion-dollar question. How? How in the world does a random compound found in the dirt of an island have this kind of insane effect on the fundamental process of aging itself?
Well, the clue is actually right there in the name.
the mechanistic target of rapamycin, or mTOR for short. Scientists figured out that rapamycin works by blocking this one specific pathway. And mTOR isn't just some minor player. Think of it as a master switch inside our cells. It controls growth, it controls metabolism, and its whole job is to sense when there are enough nutrients around to say, okay, time to build and divide.
Yeah, the best analogy is a gas pedal. mTOR is the gas pedal for your cell's growth. When you eat a big meal, mTOR slams that pedal down and shouts, go, 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 grow, divide. So what rapamycin does is it just gently eases its foot off that gas. It tells the cells, hey, slow down the growth, let's focus on cleaning house and repairing things for a bit. It basically tricks the body into thinking times are lean, mimicking the same life-extending effects we see from things like caloric restriction.
So you can see this is about so much more than just one potential drug. This discovery, it fundamentally changes how we even think about health, about disease, and, about the last part of our lives.
And that brings us to a really, really important point. The goal here isn't just about extending your lifespan, the total number of candles on the cake. The real prize is extending your health span. How many of those years you live well, feeling good and free from all those nasty chronic diseases? Because let's be honest, who wants an extra 10 years if you're just going to be sick and miserable?
Exactly. And this is the amazing part. Rapamycin doesn't just make the mice live longer, it makes them live healthier for longer. We're seeing studies that show it delays the typical age-related decline in their heart, their liver, even their tendons. It boosts their cognitive function, they're more active, and it even reduces the incidence of cancer. It's like it squeezes all the sickness into a much, much smaller window right at the very end. So what this all proves is that old wear and tear idea of aging, it's just not the full story. It can't be. Because if one single drug, given late in life, can slow down aging across so many different parts of the body at once, well, that means aging has to be an actively regulated process. It's not random. And if it's regulated, that means it can be targeted. Which leaves us with this final, kind of mind-bending thought. This whole incredible journey, from a scoop of dirt on an island, to a scientist saving a sample from the trash, to an accidental discovery in a lab, it has completely changed our understanding of life's limits. It has proven that aging isn't set in stone, it's flexible. And that forces us to ask a really big question. If we can already slow this process, what comes next? Could we one day stop it?